Hello, everyone. My name is Dr. Lee Tyson, and I'm the Director of Psychiatry at the University of Cincinnati College of Nursing. And I am just delighted that you have expressed interest in learning more about the role of the mental health nurse practitioner. I've personally been a psychiatric NP for over 12 years now, this being a second career path for me following an extensive journey in professional ministry. Academically, I hold 2 bachelor's degrees, one as a BSN, the other in math and chemistry, 2 master's degrees, one as an MSN and the other in divinity, and 2 doctoral degrees, one as a DNP and the other in theology and spiritual development, and 2 postmaster's certifications, one as an adult NP, Psych NP, and the other as a Psych NP across the lifespan. I'm educated beyond my own intellectual capacity. I serve as a psychiatric hospitalist in a private behavioral facility in Dayton, Ohio, where I round on about 18 patients each morning. I also founded and own Leaside Wellness, which is the largest outpatient privately held psychiatric practice in the greater Cincinnati area and the largest NP-owned and operated private practice in the state of Ohio. And while I wish I could say that I was smart enough to have chosen to enter the world of psychiatry in all intellectual and emotional honesty, psychiatry actually chose me. You see, mental wellness is quite unlike other disciplines of medicine and nursing. You can't directly see or touch the pathology that impacts the patients the way you can in many other fields. You can't look at depression under a microscope or dissect schizophrenia in an anatomy lab. There's no MRI or conclusive scan that you can run to detect the presence of PTSD. Psychiatry is an extremely unique and challenging yet wholly rewarding field of advanced practice nursing that, quite frankly, remains exceedingly underserved. But again, it is only for those who are passionate about mental health, those for whom there is something missing inside of you if you aren't practicing psychiatric nursing. I believe that one of the reasons psychiatry chose me is because I've always had a special passion for serving people in their moments of catastrophe and offering what I like to call a ministry of presence to those struggling with grief, trauma, and existential crisis. So it was in many ways a seamless transition for me to be inserted into the world of mental wellness. And so without question, I find my role as a Psych NP extremely fulfilling and in a field where I'm actually getting paid to do what otherwise I would be doing for free. What does a Psych NP do? Well, they provide assessment, diagnosis, and treatment to individuals, to groups, and families with mental health disorders, all the while identifying risk factors for such. Psych NPs help people with various mental issues and support them on their road to recovery. Some of the most common types of pathologies we manage include depression, anxiety, trauma, ADHD, personality disorders, mood and thought disorders, substance use issues. Psych NPs are also trained to offer various modalities of psychotherapy in addition to managing the medical side of mental illnesses. They offer advice and support to people and their families, just as a psychiatrist or other medical physician might. Psych NPs serve in a variety of settings, including inpatient, outpatient, partial hospitalization, intensive outpatient programs, substance use facilities, community mental health centers, crisis centers, state hospitals, schools, prisons, private practice, and the ever-booming field of telepsychiatry. The College of Nursing here at UC offers several routes to achieving your future Psych NP role. Our curriculum is both robust and streamlined, offering exceptional preparation for you to pass your certification exam as well as excel in your clinical setting, all the while helping set the table for you to have enough time and sanity to maintain a life outside of your academic endeavors. And while our curriculum embraces the standard requisite courses such as psychopathological disorders, psychopharmacology, and psychotherapy courses, our program is unique in that we do require a very popular 2-day on-site campus visit during your first semester in our program where you're able to meet and interact with your faculty and fellow cohort members. Think of this as a 2-day immersion experience that offers you the hands-on experiences that are often lost in other distance learning programs. Finally, students will have 3 internship experiences in our program, the first being exclusively focused on psychotherapy, the second being accentuating medication management, and the third being a synthesis of all of your learnings together. As you can see, being a Psych NP is a very exciting discipline, and I'm passionate about it, and opportunity abounds in this field where there sadly remains to this day a dearth of care. So, do you have what it takes to be a Psych NP?